A 25 years old man is found to have carcinoid syndrome. Which of the following hormone is released by the carcinoid? So the carcinoid is one of the tumor, and the carcinoid syndrome, it is the manifestation of the tumor. So let's see, the options are the serotonin, dopamine, noradrenaline, adrenaline, and aldosterone. So which of the substances is released by the carcinoid syndrome? So the carcinoid syndrome means a definitive clinical feature present due to the secretion of the carcinoid tumor. So the carcinoid tumor, it secretes the serotonin. So carcinoid tumor, it secretes the serotonin. The serotonin is metabolized by the liver when it goes in systemic circulation, and the active ingredient of the serotonin, it causes the clinical feature. So the carcinoid tumor and carcinoid syndrome, they are not absolutely same. The carcinoid tumor is tumor, and carcinoid syndrome when the symptom complex develop, and it is originated from the neuroendocrine cell. So the carcinoid syndrome and the carcinoid tumor, they are originated from the neuroendocrine cell, mainly from the intestine. It may be from midgut, it may be hindgut, and also in the proximal part, but most commonly it is from the appendix, but it can also arises from the rectum, also from the bronchi. And hormonal symptom, this point is very important, that the hormonal symptoms mainly occurs when the disease is spread outside the bowel wall. That means the disease, it is spread to the blood, and when it is metabolized by the liver, then the metabolized product, it causes the clinical symptom of the carcinoid syndrome. What are the clinical feature of the carcinoid syndrome? The clinical feature of the carcinoid syndrome, first of all, it may be insidious for many years. That means the carcinoid tumor presents, but the symptom not appears. That means in hidden form, it may be present a longer duration. Then the other presentation, including the flushing of the face, palpitation, pulmonary valve stenosis, and tricuspid valve regurgitation, bronchial asthma, and severe form of diarrhea, which is secretory persistent despite fasting. So this is carcinoid syndrome in short. That means the clinical features are the flushing of the face, palpitation, pulmonary valve stenosis, asthma, and severe diarrhea. What are the investigation? This is very important. The carcinoid syndrome may be diagnosed by different type of investigation. The first investigation, which is usually done, is the 5-hydroxyindole acetic acid, or Fawzia, in the urine sample. So in the urine sample, 5-hydroxyindole acetic acid is found. Then somatostatin receptor scintigraphy is another option. Then in case of the blood testing, what found? In case of the blood testing, there is the chromogranin A, and also the CT scan for the diagnosis of the carcinoid syndrome. So the carcinoid syndrome, this 3 point is very important. First of all, in the urine 5-hydroxyindole acetic acid, in the blood chromogranin A, and the carcinoid syndrome also diagnosed by the CT scan and the somatostatin receptor scintigraphy. And what is the treatment? Treatment is the octreotide and surgical removal, but the definitive treatment is the surgical removal, because the octreotide, it reduces the symptom, but it not reduce the disease. So here important rule of the carcinoid syndrome, rule of third, that means 1/3 multiple, 1/3 small bowel, 1/3 metastasize, and 1/3 second tumor. So carcinoid tumor, it secretes the serotonin, and the carcinoid syndrome only occurs when the presence of the liver metastasis, and the hormone released from the primary lesion will typically be metabolized by in the liver. So what is the secretion or hormone secretion by the carcinoid? It is the serotonin. So serotonin is the hormone which is released by the carcinoid syndrome. Other options here, such as dopamine, noradrenaline, adrenaline, aldosterone, it has no role with the carcinoid syndrome. And the diagnosis in the urine, it is the 5-hydroxyindole acetic acid, and in the blood, it is chromogranin A.